welcome. I'm Dr. Trovato here. I've got a really exciting new treatment for cellulite. I have a panel here with me and let them weigh in. The treatment is called Aveli, and it is basically a means of disconnecting the septa that are in cellulite that make that skin pucker in. So these guys really do a lot of this, and I do too. So Jason, tell us a little bit about your experience with Aveli.
So we've been using this for a while now, and the initial use was in lipo patients who are already having anesthesia, already having their tumescent in, who are getting lipo, but have some dimples. So what we do, you activate the light, you put this under the skin where the dimple has been pre-marked, you extend this and you tug back where the dimple is, and then you release unblade the knife so that you can cut the dimple, and you see this miraculously pop up in front of your eyes. It's interesting that the dimple or the strand that's holding it down is often not where you think it is. It's off to the side, off to the front. So we learned quite a bit about where these structures live with this device.
And so Barry, you've been dealing with both invasive and non-invasive means of treating cellulite in your practice for years. Where does this fit in? How does this stack up?
So this tool, which is ingenious, is really for the dimples. We call that grade 3 cellulite, the deep ones. Other cellulites have loose skin, wrinkles, which need to be treated in other ways. But the beauty of this is you don't need some big device that's very expensive, and you can target it. Now, for example, if you had younger patients who have good skin and good turgor there, and you're going to get all those dimples on the buttocks or the lateral, this tool alone will do a great job with it.
Mm-hmm. Jonathan, you use this as well.
You want to hold it too?
What's the conversation you have with your patients in terms of what they're going to feel, their recovery, all that?
So I do a lot of liposuction. I do a lot of liposuction on the awake patient, and so I build this into that discussion by saying you're going to have a recovery period that'll involve some compression, a little activity avoidance. But I say that the really amazing thing about this device is that it lets me be super selective about the depressions that I target. I don't have to wave a pickle fork or some kind of a blade underneath the skin and risk seromas. I can go after those individual bands that are holding us down.
Now, speaking of depressions, cellulite isn't the only depression you can go after with this. I've had several patients who have depressed scars that's all pulling down, and we've tried to do pickle fork there, and for whatever reason, it's just not as powerful. And as Jason said, once this is deployed, you see all the forces, and they may not just be under where you're treating. So this is very effective at releasing, whether it's the dimple from the cellulite or the depressed scar tissue. So it does have uses on anything that's depressed under the skin, held down by fibrous tissue.
How much time does the average treatment take you in the office?
So it depends on the case. So either we add it to a liposuction, which it takes a couple of minutes, you're adding it to a liposuction, or we're using it as an isolated procedure for those patients who have dimples, in which case the difference is the tumescent that we place is way more limited than if we're doing lipo on the same patient. And in that case, it might take an hour to treat a patient, but adding to a lipo patient only takes a few extra minutes.
Sure.
And the actual technique, you see a lot of buttons here. I don't know if you can see the light on here, but you go in, you mark the area, you'll see the light as a guidance under the skin. You move forward, that deploys this, but when you press this button, it actually, the knife becomes exposed, and then you pull back, and as Jason said, you can see the tugging, and you may do that a few times till it's completely divided.
And we keep one of these in our exam rooms also, a demo unit to actually show the patients what they're doing. It's very easily explained to the patient, they all understand it.
So we would agree this is the most precise way, at least, to deal with the fibrous septa and treat cellulite. That is Aveli. Thank you.